Welcome to today's deep dive into Lentiglobus, a rare but significant eye condition affecting the lens. Join us as we explore its complexities, from its origins to management strategies. This video will provide a comprehensive overview of Lentiglobus, shedding light on its causes, symptoms, diagnosis, and available treatment options. The exact cause of Lentiglobus remains somewhat elusive, making it a topic of ongoing research. However, most cases are believed to be congenital, meaning they are present at birth. These congenital cases are often associated with developmental abnormalities during the early stages of fetal lens formation. Genetic factors may also play a role in some instances, although specific genes haven't been definitively identified. Acquired Lentiglobus, while much rarer, can occur secondary to trauma or other ocular pathologies, like high myopia or uveitis. Lentiglobus is characterized by a localized, sharply demarcated bulge or protrusion on the surface of the lens. This distortion is due to an abnormal thinning or weakness in a localized area of the lens capsule, the outer membrane enclosing the lens fibers. The internal lens fibers then herniate outwards through this weakened area, creating the characteristic globule-like projection. This protrusion disrupts the normal refractive properties of the lens, leading to irregular astigmatism and distorted vision. Lentiglobus is considered a rare condition. Precise epidemiological data is scarce due to its low prevalence. It is estimated to occur in less than 1% of the population and affects both genders equally. Congenital cases are typically diagnosed in childhood, while acquired cases may present at any age depending on the underlying cause. Studies are difficult to perform given how rare it is, so further research is necessary to estimate prevalence more accurately. The primary symptom of Lentiglobus is blurred or distorted vision. The degree of visual impairment varies depending on the size and location of the lenticular protrusion. Patients often experience irregular astigmatism, making it difficult to achieve clear vision with spectacles alone. Other symptoms may include monocular diplopia, or double vision in one eye, glare, and halos around lights, particularly at night. In some cases, strabismus or eye misalignment may also develop. Diagnosis of Lentiglobus typically involves a thorough eye examination by an ophthalmologist. Slit lamp biomicroscopy is crucial for visualizing the lenticular protrusion and assessing its characteristics. Corneal topography and optical coherence tomography (OCT) can help in quantifying the degree of lenticular distortion and mapping the corneal surface. These imaging techniques provide detailed information about the location, size, and shape of the Lentiglobus, aiding in accurate diagnosis and treatment planning. While there aren't strictly defined subtypes, Lentiglobus can be broadly classified based on its etiology: congenital or acquired. Congenital Lentiglobus, as mentioned, is present at birth and often associated with other ocular or systemic abnormalities. Acquired Lentiglobus, on the other hand, develops later in life as a result of trauma, surgery, or other ocular conditions. Understanding the underlying cause is essential for appropriate management. The management of Lentiglobus depends on the severity of visual impairment and the patient's age. Mild cases may be managed with spectacle correction or contact lenses to correct the astigmatism. However, these methods often provide limited visual improvement. Surgical intervention, such as lensectomy or cataract surgery with intraocular lens implantation, is usually necessary for significant visual improvement. In children, early intervention is crucial to prevent amblyopia, or lazy eye. The choice of surgical technique and intraocular lens power is tailored to each individual case. As Lentiglobus is often congenital and related to developmental abnormalities, specific preventative measures are limited. Maintaining good prenatal care, including proper nutrition and avoiding teratogens, may reduce the risk of congenital ocular conditions in general. In cases of acquired Lentiglobus related to trauma or other ocular pathologies, prompt and appropriate management of the underlying condition may prevent the progression or development of Lentiglobus. The prognosis for patients with Lentiglobus depends on the age of diagnosis, the severity of visual impairment, and the effectiveness of treatment. Early diagnosis and intervention in children are crucial to prevent amblyopia and maximize visual potential. Surgical management can often significantly improve visual acuity and quality of life. Research is ongoing to explore newer surgical techniques and intraocular lens designs that may further optimize visual outcomes. For instance, studies are investigating the use of femtosecond lasers to improve the precision of lens surgery in these complex cases. Future research may focus on genetic screening and early detection methods.